Hi, this is Yaffi Lvova, registered dietitian and owner of Baby Bloom Nutrition. Welcome to Naptime Nutrition. Today I'll be talking about weight gain during pregnancy. This is a really big topic and it's a very sensitive topic also, so I'll try to be really conscious of that. So, you're eating for two. What does that mean? Well, I've spoken before about the limitations of calories and the definition of calories and how it's not really the best way to measure our food, but it's the best thing we have. So for lack of a better way to explain it, throughout your pregnancy, I made it. Thanks for coming, Paula. It's nice to have you. Throughout your pregnancy, you're going to have about 300 calories per day. And it's a little bit different at different stages, but that's your average. So what does that mean? Well, what do 300 calories look like? It could be an English muffin with butter, egg, and half a cup of fruit. It could be 1 cup of cereal, depending on what kind of cereal, with milk and a banana. It could be 1 baked sweet potato with sour cream, yay sour cream, and a cup of fruit. So, it could be a lot of different things. My point is that it's not a ton of food. So when you're eating for two, you're not eating for two adults. You are eating for yourself and a growing fetus. So really, how much should, baby's waking up. How much should you specifically be eating on any given day? Your body is going to tell you. I've mentioned intuitive eating a number of times, and it really just comes back to that. When you pay attention to your body, you honor your hunger, you listen to when you're full, your body is going to tell you how much nutrition it needs at any given time. And you just really need to pay attention. I was telling my boys this morning, we're having a whole conversation about how to listen to your belly. And the thing is that the TV is loud. Your kids are loud. Your husband's probably loud. Your cell phone is loud. Your Facebook feed is loud. And your tummy is really quiet. So you really have to pay attention when you're having a meal to really feel if you're hungry or if you're full. You have to listen to your whispering tummy. So, the hiccup with that is that sometimes people will have a change in their biology which really interferes with those signals. For one example, Hyperemesis Gravidarum, which is also just called hyperemesis or HE. This is what Princess Kate had, which had her hospitalized at the beginning of at least her first pregnancy. I'm not sure subsequent pregnancies if she experienced that, but 0.3 to 2% of the population of pregnant women will experience hyperemesis, which is really just crazy morning sickness, and it's all day. You can't keep anything down. A lot of times you end up hospitalized, and sometimes you need an IV drip for your nutrition. It can get very bad, and if you feel like you're experiencing this, definitely contact your physician for help with that. 70 to 80% of women experience morning sickness, which is generally at the 6 weeks to halfway through the pregnancy, maybe depending. I had morning sickness until 16 weeks exactly with my twins, and I think 18 weeks with my single. So it's very personal. Sometimes it's in the morning, sometimes it's throughout the day. And if you feel like you're not getting enough nutrition because of your morning sickness or because of possible hyperemesis, really speak to your doctor. You may want to work with a dietitian to make sure that you're getting adequate nutrition throughout the pregnancy in order to support that growing fetus and to have a healthy outcome. So, right, consult your doctor if concerned. So why is weight gain important during pregnancy? If you're only having an 8-pound baby and you were 8 pounds overweight to begin with, why be concerned? Well, adequate and consistent fetal growth really means that you need to gain weight, and weight gain is very important. And this is a very touchy subject, especially if you have a history of not being happy with your body or not being happy with your weight. So the truth is, every time you go to the doctor, they are going to weigh you. This may upset you, and you don't have to participate in seeing that. You can ask for a blind weight, which basically means you turn away from the scale, they record the weight without discussing it with you, and you don't look. You don't need to know the weight. They need to know that your fetus is experiencing adequate and consistent growth throughout the pregnancy. It is an important marker for health. It is not an important marker for you to know about for your sanity unless there is a concern. So you can speak to your doctor or the nurses, the medical assistants ahead of time and say that you don't want to hear the number. It's perfectly reasonable, but it is very important for you to get weighed at those visits. So what is normal as far as weight gain after I talked about the whole conversation about triggers? Okay, so heads up, triggers. Depending on your weight status before the pregnancy, you could be advised to gain anywhere between 11 and 40 pounds. Yes, that's for a single. It depends where you're standing ahead of time. If you were underweight before the pregnancy, you want to gain more in order to support your baby's growth. If you were a little bit larger before, you don't need to gain as much, but it's very personal. It has to do a lot with your health status and a lot of different factors ahead of time, and it's really best addressed by your doctor or by your dietitian, someone who's looking at your medical chart and can advise you as a specific person, not as ex-pregnant woman. So short personal story, because I hear it's good to share these things. When I found out I was pregnant with twins, I was working in a hospital. I was working in clinical nutrition, and clinical nutrition is very number crunching. It's kind of like the accountancy of nutrition. So everything was a number, everything was an equation. So I quickly plugged in an equation to see how much protein I should be having. And I was a vegetarian at the time, and I left work. And it was like 8 o'clock, 9 o'clock at night, and I went straight to the store to get protein powder. I never opened it. I think I threw it out last week. So, you know, it gets scary with the numbers, and you look at the numbers, but the truth is that your body is going to tell you what you need, and you just need to listen. I also looked up the numbers as far as how much weight I should gain for a twin pregnancy, and it was 37 to 52 pounds. Very specific and a very large range. And it didn't really tell me a whole lot, because the truth is there isn't a whole lot of research on what the perfect number is. There are a lot of factors contributing to that perfect number of weight gain during pregnancy. And it does have to do, again, with a lot of personal factors, a lot of personal medical history. And so I was really trying to go in that target, you know, because that was the goal, and it was something that I could try to control. But you think you can control these things, you really have no control over it. Recent studies have shown that that a woman's weight will fluctuate with a pregnancy almost independent of what she puts in her mouth. So digest that for a second. Yes, pun intended. Your body's going to do what it needs to do to support a healthy fetus. And the best thing that you can do is to put natural, healthy foods in your mouth, and your body will take over the rest. Our bodies are smarter than the textbooks. They've been around longer. And our bodies are smarter than anyone on TV, or your body is smarter than me. And you can take care of yourself. Your body will take care of that baby. So try to keep that in mind when you look at mass information for health, okay? Any information on your nutrition or health should come from someone who has your medical chart and can advise you as a specific person, not as the idea of a person. Okay, so what happens when you have high gestational weight gain, which means high weight gain during pregnancy? It means that there's a low growth restriction, which means your baby can get very big. Maybe it's a problem, maybe it's not. It depends on your situation. It also means that you have an increased risk for weight retention, which is a fancy way of saying you'll have trouble losing the weight. Okay, well, that's another topic for another time. It can also increase your risk for hypertension during pregnancy, which is also called preeclampsia. And preeclampsia actually may be more related to edema, and it could be a whole cycle. There's a lot of research going on. It can be very difficult to get research on these topics just because it's not ethical to do studies on pregnant women and fetuses. So that's why all of this is, a lot of this that I'm talking about is weak evidence. Even the charts that tell you how much weight to gain, they just don't take into account a lot of factors, because it would be very difficult to control for those factors. So in the future, hopefully we'll have better guidelines, but then it may not relate specifically to a number on a scale. It'll more likely relate to certain blood levels and other markers of nutrition and health. So the biggest determinant of a healthy outcome as far as weight is really your pre-pregnancy health status. If you are a healthy person going into the pregnancy, you are more likely to have a healthy pregnancy. And it makes sense, right? If you try to lose weight or restrict the amount of weight that you're gaining during a pregnancy, that can actually lead to more weight gain. And that would be unhealthy weight gain because it's coming from a place of restriction. If you're telling yourself, I'm going on a diet during this pregnancy, or I just found out I'm pregnant, I'm going to go on a diet, what happens is your body, being that your body is very smart, tells you, no, you really need that. And you're going to fixate and you're going to fixate. And then you're going to give in, so to speak, and eat this food that was forbidden. And it's going to result in weight gain for a couple of reasons. One is that you could end up binging, you could end up overindulging in general, and also because of the thrifty phenotype, which means that if you restrict your body's nutrition intake, your body is going to hold on to more that you put into it rather than processing it appropriately. I'm also going to be talking in the next few weeks about stress and how that impacts your nutrition and your digestion and absorption of nutrients. So that also relates to this, that if you are stressed out, you're not going to, you change actually the pH in your system. You change the pH of the acid in your stomach. You change how you're digesting food and how your body can accept that food as nutrition, as fuel. So keep that in mind as well. So how about some good news? I did see a study that high flavanol chocolate increases placental function and decreases your risk of preeclampsia. So what is high flavanol chocolate? I don't know. I need to go back and look. But chocolate, good. Right? Good news. Okay, so if your baby weighs 7.5 pounds, just kind of middle of the road, what else is in there? Why am I gaining so much weight if it's only, like, why shouldn't I just gain 7.5 pounds? Well, let's talk about the breakdown. And this is very generic, okay? It's not exactly what's going on in your pregnant body. This is just textbook. Okay, let's say baby is 7.5 pounds. The placenta, 2 to 3 pounds. If you have twins, that could be 2 to 3 pounds each. Amniotic fluid, 2 to 3 pounds. The uterus, 2 to 5 pounds. Breast tissue, 2 to 3 pounds, sometimes a lot more. Increased blood supply. When you are pregnant, your blood supply increases enormously, and that itself weighs about 4 pounds of blood. Stored fat for delivery and breastfeeding is 5 to 9 pounds. So that's a lot of different factors going on that contribute to your weight gain. So what does it come back to? Pay attention to your body. Your body is going to tell you during pregnancy and during breastfeeding how much nutrition you need at any given time. If you feel that you are having morning sickness or hyperemesis that's getting in the way of getting adequate nutrition for your growing and thriving baby, consult your doctor, consult your dietitian. If you need a referral for a dietitian close to you, contact me. I can either work with you on phone or I can send you a name of someone local if you want to see someone in person. So comes back to the Michael Pollan quote again. Eat real food, mostly plants, not too much. So go indulge in your high flavanol chocolate and feel free to send me some also. And I'll see you next week for Nap Time Nutrition. And I do personal and small group counseling. I'm getting ready to start my new family meal planning boot camp, which is now called Save My Sanity. Nutritional confidence for busy moms. So if you are interested in that, it's small group counseling, please contact me. I'll get you signed up for the new group coming. It's going to be starting April 15th. I'm going to be at the Mommy Marketplace this coming Sunday in Tempe at Kiwanis Park from 9 until 1. And I'll be giving a workshop on nutrition and new motherhood at Momplex on, I forgot the date offhand, but contact me. I will give you that information. And I'm always open to nap time nutrition topics, so please let me know. Comment below and let me know. Are you happy with your weight gain during pregnancy? See you next week.